Okay, ma'am, please start.
Okay, fine. Thank you. Okay, so thank you to the organization for inviting me. Good evening, everyone. Myself, Mrs. Aditi Prashant Sinha. I'm Associate Professor, College of Nursing from Aiims, Delhi. And here I am today to discuss with you regarding various drug dosage, how to calculate the dosage in the form of tablet, infusions, or IV flu, or if there is any other medicines which are there orally or IV, that we will just see how these calculations are being done. So I have already shared my screen. I think, is it visible to you all? So let us begin with. So I'm going to explore about calculations and dosing of fluids, infusions, and drugs. So let us start with, we know all the medications, they are the primary modality for the patients with the restoration of the health. And medication administration and evaluation are essential to the nursing practice. And we all are aware of the patient safety rules. And as per the patient safety, one of the aspects of the patient safety is safe administration of the drugs. The nurses need to have knowledge and understanding of pharmacokinetics and preparation of the required dose to get the desired effect. So, how do we calculate for each one of them? If we have to start with that, preparation and administration, that is what is our major role in medication administration, so which requires accuracy by the nurse. So always we need to remember that we have to remember the 5 rights of the drug administration to ensure safe drug administration. So the 5 rights are: right patient, right medication, right route, right time, right dose, right documentation, right to refuse, right patient education, right assessment, and right evaluation. Now, if you may be thinking that I'm just saying 5 rights, but I am here counting more than 5. Why? Because as per the patient safety rule, now these guidelines have been changed from rule of 5 to rule of 10. So we have right patient, right medication, right route, right time, right dose, right documentation, right to refuse, right patient education, right assessment, and right evaluation. So what are we going to do it today is about right dose. So that is what our focus is that how to calculate the right dose for the patient. So for the right dose, drug dosage calculations are required when we know that the amount of medication which is ordered, or we can say which is desired, is different from what is available on hand for the nurses to administer. So I have brought some formulas with some examples so that we will be able to make it easy to understand. So if we look at the formula for calculating a drug dose, the simple formula is D by H into V is equal to A. So what is D over here? D stands for desired. So what is the desired strength which has been given to the patient? Say, for example, the physician orders 150 mg. So this 150 milligram is my desired drug to be administered. H is the medication on hand. That is the medication which is supplied in which form. I need to give 150 mg, but the capsule or a tablet that comes as of 300 mg per tablet. So how do I give this 150 mg? That is what I need to calculate. So medication on hand is 300 milligram. That's an example. V is the volume of the medication which is available. So volume is whether it is available in a tablet form, solid, or it is available in the liquid form. So whatever it is, we have to add that quantity or the volume, and whatever comes A is the amount of medication which is required for the administration that comes as that. So for example, say here one example is given that physician orders 150 mg and the medication in hand is 300 mg. The volume of medication, they say 100 mg per ml. It's a syrup which is available in 100 mg per 5 ml. So how do I calculate? D by H into V is equal to A, or D by H into Q is equal to A. Quantity or volume is the same. We can replace both the words. So here you have 150 divided by 300 into what is the volume? That is 1 tab. So 1 tab, so what comes as 150 divided by 300 is equal to 0.5 into 1. That is, I need to give 0.5. That means half tablet is to be administered. So I hope that this is a simple formula which we are going to apply in so many places with so many examples and which should be very clear to know. So let us look at this example number 1, that we have toprolol, that is toprolol XL, which is metoprolol, which is beta blocker, antihypertensive. And I need to administer 50 mg per orally, which is ordered. And this drug is available as 100 mg per tablet. So how many tablets would the nurse administer? Now, if you just don't even follow the formula, you know if it is at 100 mg and I need to give 50 mg, obviously it comes in my mind. What is so simple to calculate? It is only half tablet is to be given. But if the strength varies from here and there, I actually need to calculate as per the accurate dose. So it will come as D by H into V. Now look at this. So here's step 1. What I'm going to do is determine your givens, like the amount which is desired, that is 50 mg. The amount in hand is 100 mg and the quantity is 1 tablet. So plug in what you know into the formula and simplify. So 50 mg divided by 100 mg into 1, it comes as 0.5 tablet. So what is this 0.5? If I don't write the unit, it has no meaning of it. So always you should remember that whatever the drug is available, whether it is microgram, macrogram, milligram, gram, so that I need to specify. So we should administer 0.5 milligram of that particular tablet to give 50 mg to my patient. Hope that this is clear to you. Now look at the second example. Second example is 1200 milligram of chlorcorn is ordered. What is this chlorcorn? That is injection KCl or a tablet KCl, that is potassium chloride. This medication is only available as 600 mg per tablet. How many tablets should the nurse give? So even if we look 600 mg per tablet, I'll give 2 tablets. But yes, to get the accuracy, if you put them into the formula, we should always recheck for the accuracy of the exact dose of the drug. So determine your given, that is desired is 1200 mg and amount in hand is 600 mg and you have quantities 1 tablet. So plug in what you know into the formula and simplify it. That is 1200 milligram divided by 600 milligram into 1. That comes as simplified 2 tablets. The same formula can be used for the calculation of the dosage where the medication is available at some certain volume. So in these type of calculations, the volume which is available in hand is quantity. So that is why I said when we put as D by H into V, so V is equal to as quantity. So if it is available in some volume, we can add certain volume. Otherwise, we can just write the quantity. So D by H into Q is same as D by H into V. And that is equivalent to the amount which you are desired to be given to the patient. That is the required dose for the patient. Clear? Now coming to the next. Another example is dilantin. What is this dilantin? Dilantin is anti-epileptic drug. Hope that everyone is aware of it. So this is 120 mg is available as 125 milligram per 5 ml. Now you see the volume is now here is 5 ml. So that means it's available in a syrup. And this dilantin 125, it is available. So how much it is ordered to be given? 0.3 grams per orally is ordered. Now just check it again that you have 125 milligram is available per 5 ml. But here what is important is that this dilantin is now to be given as 0.3 grams, whereas available strength is milligram. So how much should the nurse administer? So what I am supposed to do it here is I have to convert this grams into the milligram, and otherwise I'm not going to get the desired amount. So here you have amount desired is 0.3 grams and in hand is 125 milligram and you have the quantity is 5 ml. So what are we supposed to do? Step 2. So instead of just putting this 0.3 into the formula, we are going to convert this 0.3, so 0.3 grams into milligrams. Since The ordered drug dose is in grams, but the drug is available in milligram. So how do I go for it? 0.3 grams into 1000 milligram per gram. So that comes as 300 milligrams. So that means zero point 0.3 into 1000, which gives rise to 300 milligram. So now it is simpler for me with how much I need to give a desired amount, that is 300 milligram. So plug in what you know into the formula and put into it. So 300 mg divided by in hand strength is 125 mg. And here you see the volume is specified as 5 ml. So you write into 5 ml. So 300 divided by 125 into 5, what comes is 12 ml. You can calculate even on your own and put it in the formula and do it on your own. So what is how much dilantin is to be given? Now I have to administer 12 ml of dilantin to the patient to get the desired amount of 0.3 grams. I hope that I am able to clear what I wanted to give a message to you, that you have to convert grams into milligram because the available drug was available in the form of milligrams, not grams. Clear? Now look at the next example. Furosemide, we know what is furosemide. Furosemide is a diuretic which is available as 40 mg in 1 ml. So 10 mg is ordered to be administered through an IV. So what amount of furosemide should the nurse administer? So here I have the required dose is D, that is desired strength, which is 40 mg. Volume is 1 ml. And how much is, available strength is 40 mg and 10 mg ordered. The required one is 10 mg and it has to be given in IV. So its volume is 1 ml. So now look at here is D by H into Q. We don't have to convert it over here. So 40 mg and 10 mg. So 40 mg is the available strength. So 10 mg divided by 40 mg into again 1 ml, which is coming as 0.4 ml. So how much furosemide I need to administer to the patient? That comes as 0.4 ml. So you administer 0.4 ml of furosemide. Right? It is not difficult. Only the thing, if we know the formula and how to calculate, it is very easy. And in our day-to-day basis, we should always use this formula to check the accuracy of the drug. Right? Now coming to some of the doses also can be calculated based on the body weight. So dosage calculations can be used based on the body weight, which is required when the dosage ordered and administered is dependent on the weight of the patient. Say suppose many of the pediatric drugs which are ordered, they are ordered as per the weight of the child. So weight of the child in our Indian setup, we get it in kg. But if it is not so, then we are supposed to convert it into the kilogram. So dosage calculations based on the body weight are calculated in two main stages. So you have something which is new that you have to calculate as per the weight of the baby. Now look at this example. So dosage calculation, which is based on the body weight, are required when the dose ordered, administered is dependent upon the weight of the patient. For example, of your pediatric patient. So this are calculated by stages like stage number 1. Use the formula, calculate the total required dose based on the given body weight. Say suppose the formula is weight into dose ordered per kg and equal to Y, that is required dose. So here, first you have to change it into this formula. That means weight into the required dose. And then you will apply the same formula of D by H into Q to calculate the actual amount of medication which is to be administered. Now look how it has to be done. Just look at the example. Medrol. Medrol is solumedrol, which is again corticosteroid, which is 4 mg per kg, is ordered for a child who is weighing 64.8 pounds. And Medrol is available as 500 mg per 4 ml. So how many milliliters of the or ml of medication must nurse administer? Now you see, if you look at this question, you may feel that how difficult it is. How will I do it? It is such a simple step. You have to convert this weight first into the kg, and then you have to put into the same formula. So here you see how it is done. In the step 1, your weight is 64.8 pounds. So, and your drug ordered is 4 mg, and the available drug in hand is 500 mg. So, all that which is clear, and the volume which is given is 4 ml. So, now next convert this weight. So, 64.8 to convert, that is divided by 2.2 pounds per kg, which is, so that comes as 29.45 kg. Now here in this example, this is the example which is taken from somewhere. So it is for converting this into a weight. But here in Indian setup, you don't have to convert because you will be getting as a child with 20 kg, with 26 kg, with 28 kg. So it is always the unit of available weight which will be there, that will be there in terms of kilogram. So here the infant weight is coming as 29.45 kg. Now put this into the formula, that weight into dose ordered. So 29.45 kg into how much dose is ordered? That is 4 mg of Midrol. So 4 mg per kg, which is coming as, it is into. So 29.45 into 4, which is coming as 117.8 milligram. So the required dose of medication is 58.64 milligram. Fine. Why? Because they said that Midrol is available in 4 mg per kg, and sorry, Midrol is available in 500 milligram per 4 ml, and how much is to be given? 4 mg per kg to the child. So per kg, when it comes as 29.45 into 4, it is coming as 117.8 milligram. Now it is simple to put into the formula D by H into Q. So 117.8 is the desired strength, and availability is 500 mg. Volume is 500 mg per 4 ml. So it is 4 ml. And if you calculate, you can use the calculator. If you calculate, you are going to get it 0.942 ml. Now you cannot give 0.942. So you have to make it as 0.9 ml to get the accuracy of the medication. Is that clear? Okay. Now next move on to the another example. A physician or a doctor prescribes 250 milligram of ceftin, which is to be taken by a 20.5 pounds infant every 8 hours. Ceftin, you know, that is cefirexin, and that is what is cephalosporin, one of the type of antibiotic, and it has to be, it is prescribed as 250 milligram. And the medication label which indicates is 75 to 150 milligram per kg per day is the desired dose range. Is this doctor's order within the desired range? Because they have prescribed 250 mg for itna weight, 20.5 pounds weight of a baby, and which has to be administered every 8 hours. So here also, the weight of the baby is in pounds. So you have to convert it into the kilogram. So once it converts into the kilogram, so how are you going to get your desired dose? That is 75 to 150 mg per kg. You're going to calculate as per that. Now look at this step. So you have your dose ordered is 250 milligram of ceftin, and desired dose ranges from 75 to 150 milligram per kg per day. Now, how do you get if the child's weight is 9 kg? So here you have converted this 20.5 pounds to the kg, which is divided by 2.2, and you get 9.32 kg as the weight of the baby. Now, if you have a weight of a baby who is having a 9.32 kg, what I am going to do again, you have to multiply it with the dosage ordered, which is equal to 699 mg. So now I know the maximum dosage which is to be given minimum was, because here, if you look at this question, what is a trick over is given. The medication label indicates that 75 to 150 mg per kg per day. So they have given a range of 75 to 150. So minimum is 75 and maximum is 150. Looking at this minimum, you have to calculate both what should be the minimum dose and what should be the maximum dose. So here you have minimum dose is, you have to give it 9.3, you have 9.32 and the minimum desired dose is 65 milligram per kg. So here you have 9.32 into 75 milligram, which is coming as 699 milligram, and the maximum dose is, because the range was 150, so 9.32 kilogram into 150 milligram per kg, that comes at 1398 milligram. So now one more twist. One more twist is order is what? Calculate the amount of medication the doctor has prescribed for 1 day or 24 hours, and it has to be given for 3 times per day. So here the twist, one more, is that not only the range is given, but also what is there is that you have 24 hours. That means you have to calculate the 3 divided dose. So every dose is 250 mg. 250 into 3 is coming as 750 mg. So doctor has ordered 750 mg of medication per day. So this 750, when they have said 699 to 1398, since 699 is less than 750 and 750 is less than 1398, so he has ordered a dose within the desired range. I hope that this point is clear to you in this question. I will again redo it for you. Here you were supposed to give the prescribed medicine of 250 mg, but the twist was, which you have calculated was 9.3 kg. The twist was that the medication label indicates 75 to 150 milligram per kg per day. So 75 is the minimum dose and 150 is the maximum dose. So what we did, that we did for 75. So here we did what we did, that 75 minimum dose. So 9.32 into 75, 699. And the maximum dose is coming as 1398 milligram. Now they are asking that the medicine which is ordered, which is between 75 to 150, is the desired order is okay? Is the strength is okay for this baby? Yes. Why? Because you know that now this 699 is less than 750 and 750 is less than 1398. So minimum range was 699 and the maximum range was 1398. So the drug which is prescribed as of 75 to 150 milligram is within their range, and now he has ordered a dose within the desired range, and it is absolutely correct. Fine. Moving to the next. Now, next is that if you have to, I hope that this is clear to you. The next is that now how you have to calculate a IV drip rate. Okay, so when you have an order of an IV infusion, say you have to make sure that the fluid will infuse at the prescribed rate. So IV fluids have to be infused by the gravity using a manual roller, and you have to clamp or dial a flow or infused using an infusion pump. We have two ways of giving an IV fluid. Either you infuse it with the help of the gravity, dial a flow, or you can just put it into the infusion pump, and the infusion pump will run the accuracy of your fluid volume to the patient's body with the required rate. So regardless of the method, it's important to know how to calculate the correct IV drip rate, which is very important. So how do I do this? There are certain types of, calculations. So when calculating the drip rate, first identify which IV tubing you will be using. I have to see which IV tubing. Please mind which IV tubing. Why? Because you have micro drip and macro drip, both of the things which are available. You can use this proper drop factor in your calculation. So in the number of drops in 1 ml of solution, or is printed on the IV tubing package. That you have to find out, is it a micro drip or a macro drip? So your IV set which is available, it mentions that is it a micro drip or it is a macro drip. Now, what is this drip, micro and macro? That is the diameter of the needle where the drop enters the drip chamber. If you remember, just recall yourself, close your eyes, and recall as IV set. So, in the chamber, in the drip chamber, the amount of the fluid which drops in, that has the micro drip and the macro drip factor. So macro drip tubing delivers 10 to 20 GTT per ml. What is this GTT? Is drops per ml. So 10 to 20 drops per ml and is used to infuse large volume or to infuse fluids very quickly. So micro drip tubing delivers 60 drops per ml and is used for smaller, very precise amount of fluid, as we use it for the pediatric patient, for the neonate, for the infants, where you need to give an accurate micro drip to be given so that fluid overload should not take place when we administer the medication. Fine. Now here you see you have two drip rates. One is a drip chamber which has a macro drip, one drip chamber which is a micro drip, and micro drip means it is delivering a 10 to 20 drops per ml, whereas macro means it is delivering a 60 drops per ml. In these type of calculation for a given volume, for a time period, drop factor is there, and the required IV flow rate in the drops per minute is calculated. Since the fraction of the drop is not possible to give it to the patient, so what we do it round the whole number, the nearest whole number. So the macro drip is 50 drops per minute for an adult, and micro drop is 60 drops per minute for a pediatric patient. Now we have a small volume of micro drip tubing. For example, say suppose if we have a micro drip to be used, when the IV tubing is micro drip, say it is 60 drops per ml, now we know. So the drops per minute will be the same as the ml per hour. So for example, you have 500 ml, which is to be infused over 12 hours with the micro drip set, and the total volume is 500 ml. So how do I give 500 ml divided by the total time, 500 divided by 12. So it comes as 41.6. Now I cannot calculate the drops of 41.6 as a micro drip. So what will I do? I'll just make it as a round figure to 41.6. Something is more than 0.5. We move on to the next higher number. Something which is less than 5.5, we just take it to the beforehand number. So here you have 41.6 of how much we'll give. We'll administer 42 ml per hour. The drops per minute would be calculated as the total volume, which is divided by the time in minutes, which is multiplied by drop factor of 60 drops per minute, which is again equal to 42 drops per minute. So here now we'll look at the example for the macro drip. The provider has ordered 1000 ml of ringer lactate to infuse over 8 hours. Now here what you have? Macro dip tubing. Now in this macro dip tubing, how much drop factor is? 50 drops per ml. So how many drops per minute to be given to check that flow rate? So again 1000 ml divided by 8, because you're supposed to give it into 8 hours, into 608 into 60. So that means 1000 into 8 into 8 into 608 into 60. Since we have 8 hours in 60 minutes, so multiply by 15 drops to get this 31.2. So make it 31.2. It is less than 0.5. So we'll get it rounded to 31 drops per minute. I don't know, have I made it clear to you or not, micro drip or macro drip? So here for a micro drip, it was 60 drops per minute. So as per that, we have calculated. And for a macro drip, it was Micro drip, it was macro drip, it was 15 drops per minute. So we have calculated as per the 1000 ml to be administered in 8 hours. So this is how the amount comes. Now, then you have something to which you call it as IV piggy bank. If you want me to tell the example of this one, say suppose for example in injection NSAID, that is monosif. Let us look at the example of IV piggy bank. Okay? 1 gram of NSAID in 100 ml of normal saline is to be infused over 30 minutes. Now you have macro drip tubing with a drop factor of 10 drops per ml. Calculate how many drops per minute to set as an IV drip rate and use this formula with the 100 ml divided by 30 minutes. So here what is different is your volume is only 100 ml of fluid, which you are going to administer through macro drip of 10 drops per ml. So use this formula with the 100 ml divided by the time set is 30 minutes. So 100 by 30 divide into multiplied by 10, which is going to give rise to 33.3. So make it round 33 drops per minute, which can be rounded off and can be given. Right? So how we have calculated this is the formula was volume per ml divided by time, whether in hour or minutes. So it is better to put it into a minutes into the drop factor, drops per ml. So here the drop factor, it can be 10 to 20 or 15 to 20 for a macro drip, and 60 you will multiply for a micro drip. So, and what are you going to get? The answer in Y is what you get is the flow rate in drops per minute. So that means here in the previous example, what we were supposed to give 33 drops per minute is supposed to be administered to the patient. Now, next example, just look at this. Calculate the IV flow rate for 250 ml of 0.5% exposed to be administered over 180 minutes. So, how much is the fluid is 250 ml of 5%, and the time which is given is 180. And the infusion set has a drop factor of 30 drops per minute. It is not MI, it is minute. So here you have determine your given. So volume is to be administered is 250 ml and the time is 180 minutes. So your drop factor rate is giving 30 drops per ml. So you have to use the formula to calculate the IV flow rate. No unit conversions are required. Everything is available in ml. And remember to round the final answer to get the nearest whole number. So here you have the volume 250 ml. Time was 180 minutes into 30 drops into 30. So what are you going to get it out of it? 250 divided by 180. If you solve it, you are going to get is 41.66 drops per minute. Now, what is this 41.66 drops per minute? You cannot give 0.66 drops, so make it as a round whole number. That means 42 drops per minute of IV flow rate of 5% to be administered to this patient. Is it clear that how do we give this through infusion? This is the formula which have to be used for giving the accurate amount of the fluid to be given to the patient, whether it is pediatric or adult, or sometime an adult patient who is having acute kidney injury or maybe having a chronic kidney disease. So whatever it may be, we have to regulate the fluid. So it has to be administered in the proper accurate form. So this is the formula how we are going to get that how much drops per minute has to be administered with whatever the infusion drip rate is available to you. Okay. Next, look at the another example. IV infusion set is adjusted for a drop factor of 15 drops per ml. You have to calculate the 1500 ml volume of IV saline to be infused over 12 hours. So very simple. Now, what is there you have? The volume is 1500 ml. Time you have to administer in 12 hours, and the drop factor is 15 drops per ml. So here you have 12 hours. Now, what are we supposed to do? It is better to do it in a minute. So we will convert this hour into minutes. So how are we going to do that? 12 hours into 60 minutes. How much we are going to get? It is 720 minutes. Fine. So 720 minutes the time is, instead of 12 hours, we will be writing in minutes. So your volume is 1500 ml. And now you have time is not 60 minutes. This is 720 minutes into 15. So what are we going to get is 31.25 drops per minute. That means 31 drops per minute is to be administered. So how much IV saline I need to give? That 1500 that to be given for 12 hours is only 31 drops per minute. So even if the patient goes to the washroom, you stops for it or goes for any procedure, you have to restart the fluid again. So how will we give? You have to again adjust into 31 drops per minute. Look at your watch and see the flow of the drops and just make it adjust based on that. Clear? Now, next is last part of it, which is how to calculate through the infusion pump. Now, infusion pump do not have a calibrated drop factor. So, the flow rate depends upon how much volume to be ordered and the time of infusion which is required. So here your formula is again the same, that is volume in ml divided by time in hours. So here you don't have minutes. Why? Because you don't have a drop factor. So here you take the formula as within hour only. You don't have to convert it into the minutes, and you're going to get it a flow rate in ml per hour. So here just look at example, a 1200 ml of 5% dextrose, which is ordered to infuse in 10 hours by the infusion pump. Calculate the flow rate in milliliter as per hour. Now, how I am going to do so? Volume is 1200 ml. Time is 10 hours. So here, since the volume is again given in ml, so the time in hours, so you have to calculate one step using the formula. That means 1200 divided by 10 is equal to 120 ml per hour. So how much IV flow rate I will give it to this infusion pump is 120 ml per hour. Is it okay? So same, see, formula remains the same. If it is a drop factor, convert it into a minute. If it is a infusion pump, convert it into an hour, and you will get the how much ml of fluid to be administered per hour. Instead of per minute, you are going to get per hour. Now, another example, just see 600 ml of antibiotic, which is to be infused over 180 minutes by an infusion pump. You have to calculate the flow rate ml per hour. So the volume to be infused is 600 ml and the time is given as 180. So here 180 minutes, you have to convert this. We said it's a volume of ml and it has to be given in hour. So we have to convert this 180 minutes into hour. So how do we do that? 180 into 60, you are going to get 3 hours. So here you have 600 divided by 3, putting the same volume divided by time, you are going to get the flow rate. So 600 ml divided by 3 hours, what are we going to get? It is 200 ml per hour. I hope that I am very clear in explaining you these calculations. It's very simple. You have to just focus on the formula and the strength, which is going to get it into minutes or more. So you have to monitor the infusion accuracy. Once the infusion has started, monitor the rate closely to be sure that it's infusing the correct rate and check the patient's site for any sign of infiltration or inflammation. Many times it happens, you've already started the drip, accuracy is maintained, but the medicine which is flowing, it is infiltrating into the tissue rather than going into the veins. Why? Because vein one was out. So that is very important to see if there is, even when you start, is there any anaphylactic reaction the patient is reporting, the patient is telling you the pain, or when you check the IV side, is it giving a pain, is it inflamed sign? If there's anything present, please change the cannula and then administer the medication as per the required strength and dose. So that is what the summary of this section is, that I have given you an examples of how to calculate and various dosing of the drugs, fluids, and infusions, and with various examples that how can be used as for tablets, for syrup, for micro drip, macro drip, as well as for infusion pump, and also for the piggy bank, if that has to be used, how it has to be applied. So, with this, I think I have tried my best to make you clear about these calculations. And it's my humble request to all of you, you can recheck this information and do it with various examples. So once we do it, we'll always remember. And make sure that you imply this into a practical, into your clinical. So every day when we are calculating the drug and the doses are varied and the strength is different, use it with the formula. And I can just assure you that once you will apply, you will never forget in your life and you will never develop a medication error. So from your part, the negligence will not take place. So it's a message for me to practice, use it amplified every day so that you should be able to prevent medication error and the quality assurance can be given with the patient safety to the patient. So with this, I'd like to end up this session. Thank you so much for patiently listening. Still, if there are any doubts, you can always contact me. I am ready to clarify it. That's all about the calculations and the